I'd like to call to order the Health and Human Services Committee, Tuesday, September 12th, and a little after 1. Thank you. Can we have a roll call, please?
Calling the roll, Ms. Conwell.
Here.
Mr. Tuma.
Here.
Ms. Baker. Here. Ms. Brown. Ms. Brown is absent at the moment. Mr. Miller.
Here.
There is a quorum.
All right. So today we have before us Administrator Tom Pristo, and he will explain the Health and Human Services Plan, and we look forward to any questions from my colleagues. Me and Dale have kind of been following this a little bit, but we might have some more as we go along. Thank you. Take it away, Tom.
Good afternoon.
Excuse me, I'm sorry, Madam Chair. Do you want me to read the resolution into the record?
Yes, thank you.
Resolution number 2017-0141, adopting the 2018-2022 Cuyahoga County Department of Health and Human Services Strategic Plan in accordance with Section 202.10 of the County Code.
Thank you. And we can come back to the approval of the minutes later.
All right.
Go right ahead.
Good afternoon, everybody. HHS Chair Councilwoman Conwell, members of the HHS Committee. I'm very happy to be here today and to present to you the Department's Health and Human Services Strategic Implementation Plan. Before I start, I do want to just get on the record and say a thank you to Councilman Miller on all the work that he did working with County Executive Butish to co-sponsor the legislation that got us to where we are today. So thank you, Councilman. So as we go through this, why do we need a strategic implementation plan? Some of this is going to be pretty basic, but we want to start out, we want to have a greater strategic focus. We want to be able to look at job creation, economic growth, equity for all our communities and citizens, and long-term regional and global competitiveness. But also, most importantly, we want to be able to have an operational performance, a stronger operational performance, which looks at accountable leadership, collaborative leadership, and the streamlining of our services. The plan for the department is extraordinarily important. We need to address hurdles caused by systems that limit both employees and residents' ability to tap into services. We want to have a more holistic approach to services, which includes basic needs and also prevention. And we want to get to outcome-based contracting and outcome-based RFPs to determine if anyone is actually better off, get our process and our protocols to be able to look at how much do we do, how well do we do it, and is anyone better off. But this plan, our plan, it signifies a commitment to innovation, collaboration, efficiencies, and driving results that impact people's lives. And it's a roadmap. It's going to keep us, it's going to guide us over the next couple of years or so. It's a 5-year plan, which will be reviewed regularly, but it's a roadmap to get us to where we need to be. But let's talk for a minute about what we believe. What do we believe in when we talk about the department's plan? I want to start off by saying this plan is unique. I've been doing this for a long time. And what makes this plan extraordinarily unique is that usually what happens when you do a big strategic plan, you have your own vision, mission, and values. And then the county has their own vision, mission, and values. And then every department has their, everybody takes a bite out of that apple and they have their own. But what makes this plan unique is that we have shared vision, mission, and values with the county. This plan that I'm going to be presenting to you today is completely aligned with the Cuyahoga County plan. I know that Chief of Staff Sharon Sobel Jordan has talked to most of you, if not all of you, has gone over the county plan. You will see it will be remarkably similar in format and process. This is not something that's 180 degrees different than what the county's doing. This is absolutely aligned with the county plan. The vision of the county and the vision of the department is that we are a vibrant and prosperous region where everyone thrives and all things are possible. The mission, this is really significant. The mission to drive regional growth, economic opportunity, individual well-being by mobilizing cross-sector resources and providing superior services. This mission, these 5 strategic priorities, is the driver for both the county plan and the department plan. Let me say that again. These 5 strategic priorities of this mission is the driver for both the county plan and the department plan. The values, integrity, courage, teamwork, innovation, and results. it's something that, again, that the shared vision, mission, and values is absolutely aligned. Let's talk about the department. The purpose for the department, together we connect. We connect people with the opportunity to live their best lives. And we do that by adhering to 5 guiding principles. Staff are supported and have a say in how they do their job. We have programs that work and we know why they work. We pay our bills on time, commit on budget. We deliver the highest quality, best service outcome programs in the country. And importantly, most importantly, we treat each other with respect, compassion, and kindness. I want to talk to you a minute about how we started, what happened when we have 4 different phases of this plan that got us here today. Phase 1. Phase 1 started last October. I put together a steering committee. I was very fortunate to be able to get John Corlett, who's here today, to be part of the steering committee, the CEO of Centers for Community Solutions, and also Amy Morgenstern, who is a national known facilitator. Along with those 2, Chief of Staff Sharon Sobel-Jordan, and then senior members of my administration were part of the team that rounded out this process. But what we first decided to do was we wanted to define what we thought success was. What do we know, or what do we think success is when we're looking at the Department of Health and Human Services? We went through that process. We had an interim guideline on the definitions of success. We developed a plan to solicit community feedback. And then we reviewed local and national models for service delivery to see what other counties and states were doing. We solicited input from the community stakeholders. We had 27 individual stakeholder interviews. And we got that information back, we reviewed and summarized the feedback, and then we revised the definitions of success. And I'll get into those in a minute. We held listen and learn sessions that I'll talk about and that all of you were part of. And we held focus groups, and we administered both stakeholder surveys and citizen surveys. And then we wrote the plan. We analyzed over 2,200 individual inputs from our citizens and our staff and established priority goals based on stakeholder feedback and themes. Talk a bit about who we heard from. Again, as I mentioned, we had 27 community stakeholder interviews. We had 141 citizens in our listen and learn sessions. I just want to compliment Councilwoman Conway. You went to all of these listen and learn sessions. Councilman Miller, I think you only missed one. Councilman Tuma, I think you were at least one. Ms. Baker, I'm not sure if you made any or not, but there was a lot of participation in all these, and I just want to acknowledge the role you all played in not only coming, but also getting your constituents to come to the plan or come to the listen and learn forums. Our online survey for stakeholders, we had 716 responses. This included our staff. But what's really interesting is we had over 1,300 citizen surveys that were completed that we got information from, for a total of over 2,200 individual inputs of information to start designing this plan. Let's talk a bit about what we heard. So we had definitions of success, and we went out there, we had an original definition, we came back, we tweaked it a little bit. And the definition for basic needs for individual well-being is thriving residents are safe, well cared for, and empowered to prosper. 92% of the 2,200 people that we surveyed strongly agreed with this definition of success. With the economic opportunity, the definition of success we had is thriving residents are prepared to learn, educated, and college career ready. 83% of the respondents and the folks that took the survey either strongly agreed or agreed with this. Again, under economic opportunity, we had a definition of success as thriving residents are employed on a path toward upward income mobility and career advancement. 81% of the folks that we surveyed either strongly agreed or agreed with this definition. Mobilizing cross-sector resources. Now remember, if you will, that the top line here where it says mobilizing cross-sector resources, that is one of the 5 strategic priorities that's in both the county plan and the department plan. The definition of success for mobilizing cross-sector resources is residents thrive when we use data to understand their needs, learn what works, and improve practice. 85% of all the folks that we surveyed strongly agreed with this definition. Residents thrive when we value each person and effectively engage in quality interactions with everyone. 86% of the stakeholders agreed or strongly agreed with this objective. Residents thrive when we engage one another in a healthy, positive, and collaborative employee culture. 73% of the stakeholders agree with this definition of success. Now, I'm going to be going into the plan in a moment, but I want to be able to, again, make sure that there's an understanding of how the plans cascade together, the county plan and the department plan. So when we're talking about all resident, county goal number 7, all residents are safe, supported, and able to care for themselves, we're talking about at the department level basic needs. County goal number 6, every resident is on a path of upward mobility and career advancement. The department sub-goal is employment and training. County goal number 5, every student stays in school and has the support needed to graduate. We're talking about education at the department level. County goal number 14, provide a superior customer experience. That's the same, customer experience is the same as the county's. 15, county goal number 15, make Cuyahoga County an employer of choice. We're talking about at the department level, employee development. County goal 10 and 11, drive collaboration among regional partners and co-create systems level solutions. We're talking about services to outcomes. And number 12, county goal number 12, make a difference in everything we do. We're talking about outcome-based services. When you met with Sharon and went over the county plan, you saw this chart in front of you here. Again, the top line is the 5 strategic priorities: regional growth, economic opportunity, individual well-being, cross-sector resources, and provide superior services. Under those 5 strategic priorities, there's 15 county goals. We have 4 strategies with 9 county goals that we are then going to take and make our own sub-goals for the department level. So again, I want to make sure, to again showcase how this plan engages with the county plan. County has 5 strategic priorities with 15 goals. We have 4 of the same strategic priorities with 9 of those goals. So let's talk about what we're going to actually be doing over the next couple of years. County goal number 7 is all residents are safe, supported, and able to care for themselves. We're talking about basic needs at the department level, and we're going to be keying on three specific results. Have healthcare coverage that includes mental health and substance abuse treatment. Our citizens are safe from abuse and neglect, and living in stable and healthy housing. The one thing I want to just pause for a second and mention is that each one of these results that I'm going to be talking about has 52 indicators of measures on them. And I'm not going to be going through those. Those are all in the bound copy that's in front of you. Along with the 52 indicators and measures on how we're going to know if we're successful, we have 43 projects and initiatives that align with these goals to help move us along to be successful. Again, I'm not going to be going over those. Those are in the bound copy that's in front of you. Cuyahoga County goal number 6, every resident is on a path to upward income mobility and career advancement. Our goal, the department's goal, is employment and training. 4 results that we're looking for is identify and enter supported career pathways, receive training, become employed and earn a family-sustaining wage, build assets for long-term financial stability and retirement, and are engaged in community life through employment and volunteer opportunities. County goal number 4 and 5 is every child is ready on the first day of kindergarten, and number 5 is every student stays in school, has support needed for graduation or to go to secondary completion and career success. Our goal for the department is education, and the 5 goals that the 5 results we're going to be tracking are enroll in high-quality preschool, have access to high-quality childcare, graduating high school, mentorship opportunities, and have the opportunity to receive a diploma or a career training certificate. County goal number 14 is provide a superior customer experience. The department goal is, again, the same, customer experience. The 5 results we're tracking are employees are trained and knowledgeable about the department and other county services. Every person is treated with dignity, respect, and empathy. Residents are connected to resources to meet their basic needs and help. No door is the wrong door. Standards of excellence are established and consistently met. County goal number 15, make Cuyahoga County an employer of choice. Our department goal here is employee development. The 5 results that we're going to be targeting and tracking are great employees are attracted and retained. Employees support one another, collaborate across divisions, and have a say in how they do their jobs. DHH supervisors and managers demonstrate the Cuyahoga County leadership competencies, and there's 5 leadership competencies that I'll just mention real quickly. They are developing others, drive organizational advancement, cultivates and champions change, inspires and fosters respect and diversity, and promotes a culture of servant leadership. Those are 5 leadership competencies that are going to be spread out across not only the department but the county that we will be training all our staff towards. The other 2 results are employees have the tools, technology, and training they need to deliver the results, and then meaningful annual performances and reviews are conducted for all employees. One of the worst things you can do is have an annual review that is pretty much meaningless. It sits on a shelf. And actually, we're running a beta test now on a new performance review, and we hope to have it online completely in January for the county. County goal 10 and 11 is drive collaboration among regional partners and co-create system level solutions. The department goal is services to outcomes. The 4 areas we're going to be targeting and tracking are regional approaches to address and help community social issues. Divisions will evaluate racial inequities in their systems and demonstrate action steps toward addressing disproportionality. Residents and partners have improved understanding of the division and services. One of the interesting things we found in all the surveys when we did it, especially internally, was that a lot of our own staff didn't know what we had to offer across the 8 divisions among the staff that took the survey. And that we lead the community in advocating for public policy that supports the development of strong families and communities. The last goal that we're going to be talking about, the county goal is number 12, making a difference in everything we do. And our department goal is outcome-based services. The 6 areas here, the results we're going to be tracking are benchmarks and measures of performance are developed and implemented. Data is collected, valid and reliable. We have access and are using integrated data sets. This is one of the most troubling ones that we are really struggling with the state on, is getting integrated data sets. Data and information are readily accessible, analyzed, and shared. And importantly, that we use the data to inform decisions. We have to be able to start using our data to make valid decisions on programming. And then finally, employees are trained in the need for skills related to data analysis. We do a lot of, as you know, we do a lot of contracting with Case Western to do the data analytics. We're looking to have some internal support for that here. Finally, implementation. What's going on right now started about a month ago. All the divisions are getting their operational plans together, cascading them into the department plan, which then again aligns with the county plan. This officially begins January 1st, although we're well underway now with many initiatives and projects. Like I said, we have 43 that's on tap right now. A lot of them are underway. I mentioned earlier that the measurable indicators are identified for each result. We have 52 identified measures that we are going to be tracking that are outcome-based to determine whether or not we're actually being successful. We're going to be reviewing this plan regularly. I'll be meeting with Councilwoman Conwell, I'm sure, regularly to talk about this, and I'd like to come here biannually or at your convenience to give you an update on the plan as we go through this. And then lastly, we're going to go back out to the 4 areas we did the listen and learn sessions and present this plan to the community, tell them this is what we heard from you, this is what we developed, and get their input and get their thoughts and ideas. That ends my presentation, and I'd be glad to answer any and all questions you may have.
Yes, Director, glad you touched base on the last one I was going to ask. How are we going to be kept updated in the 2-year plan that you discussed that all these would be done over the next couple of years? How will we correlate that and council actually know what the agency is working on?
It's
Which
actually
goals?
a 5-year plan, but we will, I'm proposing a biannual update, but if you want to do quarterly updates, I'd be glad. It's whatever you desire, just let me know. I'll be glad to do that.
Okay, and then my other question, you had mentioned earlier at the presentation, there's always been an emphasis, since we've started talking about this Health and Human Services Plan, there's always been an emphasis on the county plan and the agency plan. And so my question is, how is this different in the past?
Well, there was no HHS plan ever, so
I know.
that's a big difference.
Okay,
But just historically and traditionally, when you have a county or a state that develops a large plan, the departments usually go on their own, and they don't even have shared vision, mission, or if they have anything shared, it's usually just one of the 3. What makes this plan so unique is that we are completely aligned with the county plan. The goals that a lot of the strategies that we're going to be measuring are in the county plan that you reviewed with Chief of Staff Sharon Sobel Jordan. So that's what really makes this thing unique, is that it's a organic living document, and that we are. I've been doing this 24 years. This is the first time that I've ever seen where I've ever aligned completely with a larger entity in a strategic plan. It's pretty awesome work.
I've always wondered why the emphasis was made, but you just explained it very well, that in your knowledge and your expertise, that this is not something that is usually done with agencies. So now I understand why there's always this, because I just think whether it's the HHS plan, it's all the county plan. So I'm glad that you explained that. I'd like the record to reflect that Councilwoman Brown is now in attendance. My last question, then I'll open it up for my colleagues. I know you didn't go into detail, but in some of the meetings that we've had, we talked about the partnerships that you would have with some of the other organizations, and Cleveland Public Library was one that I know I had asked if we could incorporate and look at. The administration has a look for the county libraries to be innovation centers. So I was just wondering if you could share, or if you knew if there was any dialogue that has been happening between the Cleveland Public Libraries in terms of being a partnership in this, because they have 27 branches, and does that partnership also include funding?
And the short answer is yes. There was a kickoff number of weeks ago where Chief Executive Armin Budish went out and did a press release with the County Public Library in Parma that solidified the relationship between the county and the county public libraries and the city public libraries to offer navigators to help our citizens track for Medicaid and other services. And also there's the other service is for GEDs, for education. So that is already in play. David Merriman is here. He was out, he tracked that. So more detail I can get you later on about exactly, but it is underway and moving now, that we have a solid relationship with the county and the city libraries. We want to get the outer ring libraries involved also, May Village, et cetera. But it's to help the navigation for our Medicaid and also for GED.
Okay, yes, I'd be very interested to know, because you talked about Parma, but just making sure that we brought along Director Felton along with that, and that there's actually, I'd like to understand a little bit how we're, as the county, is actually funding some of these innovation centers. So I want to open that up to my colleague, Tuma.
Thank you, Madam Chair. Ms. Bristow, thank you for your presentation. Appreciate that. Thanks for the work you do as well. I got a question regarding the outreach meetings that you guys put on in the various communities and such. Just from your perspective, what did you take? What was the main thing that you took away from the responses that you got from folks as to either, you know, HHS is doing what, you know, the people view it should be doing, or are there things, deficiencies that you saw that people were responding to, or maybe misinformation on some areas? You know, I'm just trying to get what was the feedback in general. If you could take away something saying, geez, I didn't know people were thinking that, you know, from a different perspective.
It was very eye-opening. One of the things, well, there's many things that we took away. The basic needs issue is the thing that gravitated, most people gravitated towards right off the bat. 93% of the residents really supported that definition of success. And the basic needs, housing, healthcare, et cetera. I remember I was sitting at one table listening to a young lady talk, and she said, well, I'm in college right now, and I may need some money to get through my junior and senior year. Is the county going to pay for that for me? Well, I don't think we can do that. But so it was interesting, the width and breadth of the type of most social services type of issues people were talking about getting support for. Education was another one. It kind of ran the gamut from one end where we didn't want the county involved at all to the other end where we wanted the county to pay for everything we could possibly get the county to pay for.
Yeah, it's interesting. I think Councilwoman Baker, myself being still relatively new to this, not coming in and not realizing just exactly the extent to which the county is involved in health and human services for folks, and to which people rely on to such an extent. I think it was great to get out to the communities, to interact with people, and I think, again, letting people know what your mission is an important aspect of you know, county government. You know, letting people know these services are available. A lot of folks don't know services are available sometimes, or are embarrassed to ask for services. You know, and what folks really need to realize is that, you know, there's a need for these things, and you know, sometimes you need help, you know, and the county can be there in some regard for that. So I think that's important. Another thing I just wanted to comment on that I think is really essential to this whole statement is having outcome-based results. Again, because this is, you know, taxpayer money, and people do rely on it, but how it should be used for things that are garnering positive results. Getting people on their feet, helping people out when possible. And I think having some type of outcome-based result in that is the proper way to do things, to handle things, is when you're dealing with the public's money. So
If I may, I'll share an incident that happened a number of months ago when one of the divisions was advocating to renew a program that cost about $300,000 annually. I think it was $200,000 or $300,000. So I wanted to see the data to see how well the program was doing and whether or not it was effective. The data was scant, and but there was data, and I said to the individual managers and supervisors and administrators, I said, tell me what you're doing with the data. If we changed any policy, if we changed any programs with it, and we hadn't. So I canceled the program.
Right. Right, and you can't argue with facts.
Right.
You know, and I think that, again, when you're dealing with people's money, taxpayer money, you can't argue with facts, and that again, I think is an important aspect of what this whole process is weeding out. So
the other thing, Councilman Tooman, if I may, the other thing, as we go down this path, developing outcomes with our providers and our vendors, we have to bring them along.
Right.
We can't make a right turn so quick that we lose them. They're concerned about their operations. They're concerned about their FTEs. There is up here standing last year when I was talking about budget, my experience has been when I've done this before is that there's a period of time that I've usually held vendors harmless, that we implement, we beta test it, we run through a process to get people on board, and then we start looking at how successful they are. But we have to be really sensitive and cognizant of how we structure that implementation plan so you're not getting 500 phone calls from all the providers out there, and it just has to be reasonable and it has to make sense.
Right, right. I appreciate that. Okay, that's it for me. Thank you.
Councilman Miller.
Madam Chair, Director, first of all, I would like to congratulate you and your department and your associates on a very strong effort and a very, very significant piece of work. And I particularly think the public input process was very strong. You received input from more than 2,000 people. In my opinion, it's the best, most diverse, and strongest public input process that we've had since the start of the new government. So I think that's very significant. I also think that the plan places current efforts in a broad context and also identifies some new priorities. So that's what a plan should do. So that's good. You asked the question about the updating of the plan, and I think that it's important to make a distinction between updating the plan itself as opposed to progress reporting. And I think as far as updating the plan itself, the biennial schedule that you suggested, I think, is a good one. It's actually more than the minimum that's called for in the legislation. So that's good. I think as far as progress reporting, quarterly would be good. Just to give us information on how the performance is tracking against what the plan envisioned. So,
Councilman Miller, if I may, when we do the quarterly reporting, which I have no issue with, I think that would be fine. We also will use that in the quarterly, at least initially. This is where we start tweaking indicators and measures as we roll this out in January and start looking to make sure that we have the right indicators in play. So at the same time, we'll do the progress reports. We may be switching up some of these indicators as we roll out the first year or so of this, as we make sure that we have the right measurements.
well, that makes sense. The developing the best indicators is going to be a work in progress. It's going to be a process of continuous improvement. To respond to Councilman Toomer's question about what we learned from the input sessions, one thing that I picked up from attending several of them was that a lot of people were saying there wasn't enough in the plan dealing with senior citizen issues, and there a lot of seniors attended the input sessions, yes. And the final plan was responsive to that input. It clearly had a stronger focus on senior services than the original draft. So that's something that I picked up on those input sessions. There are a few questions and concerns that I have, and I'm not in any way suggesting that the plan be further amended at this time. I'm prepared to vote for the plan as submitted, but I think there's some things to consider going forward. One is whether the plan is truly focused enough to be strategic. There's a lot in here, and it seemed a little more focused from the presentation than the plan itself. But I think that we have to make sure we come out of this saying what are a handful of things that are really the most important that we need to really give heavy emphasis to. So that's one. A second thing is about the mental health diversion centers, which are clearly referenced in the plan, but I think as we move forward, we have to think about what's the strategy, what's the method of implementation, what's the timing, and I think that's very important. This whole notion of that that we need to get the mental health and addiction community and the criminal justice system working much more closely together so that we don't have people in jail that should instead be receiving mental health and addiction treatment. So that needs a lot of attention going forward. Another question I have is, as we approach the time where we have to put some form of our levy on the ballot next year, the question in my mind is whether the current level of funding is sufficient to do these things. And I particularly note that the 2019 estimate for Health and Human Services is $30 million underwater, and if you count the fact that we're planning to draw down $5 million in public assistance funds in that year, it's $35 million, and that doesn't include all the initiatives that are in the plan. There's a lot of things that have come up, particularly in the last couple of years, that have received renewed emphasis, and are reflected in the plan. There's UPK, there's lead paint, there's the opioid crisis, there's mental health treatment and diversity, there's infant mortality, there's workforce development, there's all of those things. A couple other things that I think are kind of implied but not explicitly stated are healthcare disparities. We talked about system disparities. I think we need to look at the disparities in the healthcare system generally. Also, wellness and prevention. It's kind of implied, but there's not a lot of direct reference to how we're going to do that. And so I think the agenda is big and it has grown, and I think we have to consider what the funding needs are for that, and whether what we currently have is sufficient.
Thank you, sir.
An additional thing, you mentioned about no wrong door, and I think no wrong door is important, but I think continuing communication is a bigger need. I don't get very many complaints from constituents saying that they can't get in the door, but I get complaints fairly frequently saying that I have an ongoing relationship, but I'm having trouble reaching my caseworker and resolving problems that come along. So I think we need to give attention to that. The final thing is that I think the plan is a very, very good internal document. in terms of providing a roadmap as to how we deal with these issues. But I think as a public document, it's too busy, and when you're trying to show the alignment between the county plan, the county-wide plan, which most people aren't going to be familiar with, and the HHS plan, and I don't know whether it works as well in explaining to the general public what we're trying to do with Health and Human Services, because it's very complex and very busy, and maybe we have to think in the future about whether it's presented a little differently, or whether there's a second version that focuses more narrowly on HHS, but basically says the same thing. So you can think about that down the road. But I think as far as making a strong start for the first plan, it's there, and I again commend you on your efforts.
Thank you.
You done, Councilman? All right, Councilwoman Brown and then Councilwoman Baker.
Thank you, Madam Chair. Again, my apologies for my tardiness. Mr. Miller touched on one of the questions that I wanted to address, which was the levy, and if you've had any conversations or consideration whether you think that should be a renewal, an increase, or an extension.
I don't have an opinion on the levy as far as increase. This plan was built on the existing dollars that's available to the department as it stands right now. Those discussions are coming up soon, but I'm not prepared to comment on that now.
Okay, and as the HR chair, I get a lot of information with regards to employee turnover, and so I've noticed some senior employee turnover in the Children and Family Services Department, and speaking to the point that my colleague, Mr. Miller, made, that there seems to be, I don't know if it's a structure issue or resources or morale. Can you touch on that for me, please?
So Children and Family Services recently went through a model shift. On one end, on the other end, our retention is not any worse than it has been over the past year and a half, and our actual vacancy rate is almost a functional zero. So we're not losing or hemorrhaging employees like we had in the past. I have not heard anything at my level that made me concerned about CFS, the Children and Family Services, that staff are leaving inappropriately.
So the level of, I guess, retention you're comfortable with, are there some efforts? I see the plan with regards to the leadership and those types of training. But as the HR chair, I guess my goal is to help you be able to hire and retain more employees and keep them consistently, because of the number of resources that we put into training and turnover. It costs the county money. So is there something we can do collaboratively to address that, or at least minimize that in the future?
I know, Councilwoman Brown, that there's been a number of different issues with the PRC, both in classification and just in timing. I know they're still relatively getting their feet under them and getting things moving. And I know that Director Douglas Dykes has worked closely with you about some of the issues that concern. I think as we go forward, handling those issues to the PRC is extraordinarily important. And I don't have my notes in front of me about all those issues, but a week doesn't go by where that doesn't come up, where we're struggling with the decisions that is made by those folks. And it's not helpful to my administrators and directors when we're trying to either reclassify or hire. It's an issue, especially when we have a department of 2,300 staff. My 4 big divisions are struggling with that. And we're working closely with HR, so it's not like we're actually connected very strongly with them. And but Douglas is carrying the water on this one, Douglas Dykes.
Okay, thank you very much.
Councilwoman Baker.
Thank you, and I agree. Thank you for your work on this. This is, wow, very impressive, and I think my colleagues had good questions, trying to dig in a little bit. I guess a couple of points that I may add. The price tag of this, if I heard you right, you were working within the funding that's available. So
correct.
in your opinion, at least for now, this plan that's been put forward can work with the funding that is available today?
I submitted a budget to my bosses that takes this plan into consideration, and again, the council funds us, and you'll work through your iterations of that. But I'm confident in the plan that I submitted that I can fund what we are proposing to do in this plan.
Thank you, that's good to hear. Also, I guess I'm also glad that the outcome-based is part of this, that you are looking at not just the service, but the outcome of those services. I'm glad to see that, whether it's graduation rates, whether it's job training, or whether it's drug addiction that needs to be addressed. Those are all part of outcomes, so that's good to hear. I guess lastly, we heard a lot from our neighborhoods here in Cleveland and how maybe not aware of all that we do provide here in the county. So I guess I would ask you, for those neighborhoods who are single mother, father families, in poverty, trying to overcome and work every day and just survive on a daily basis, that may not be coming to the meetings that you offered because they're doing things just to make sure their family is taken care of to the best of their ability. How do we reach out to them? How do we get to the neighborhoods and the people that may not even be aware of all the different things that the county offers, let alone reach them enough to help them? What is your plan there?
We have hundreds of programs across 8 divisions that services our citizens. My communications department, along with my senior leadership team, is working. One of the things that we are putting into place is a way to communicate everything that we do in a way. Look, go out on the street, the folks don't care that there's 8 divisions in the Department of Health and Human Services. They either need Medicaid, or they need food stamps, or they need adult protective service. They don't care about the structure.
Right.
So I have a very strong communications department who has been together about 9 months now, 10 months, and we are working to how do we do it? How do we
Right.
start leveraging all the different resources we have to get that information out there? It's part of the plan that we have. I don't have a direct answer for you yet, but it's coming.
Yeah, if I may just follow or conclude, does it take an effort of knocking on doors of neighborhoods, of seeing, through the schools of those children that are borderline, that are ready to quit, that, may not have yet, or those that have quit and now perhaps are reconsidering?
Right.
I mean, what kind of outreach effort is there? And I guess you don't have to answer, but I'm just saying that there's probably a pretty strong population that is surviving every day, trying to do what they can within the resources that they think they have, and may not be aware of maybe the extra tutoring skills that we can perhaps help them with, or better housing that they may not think is out there, or drug addiction services that they may not think. I guess that's what I'm asking, is the hardest to reach, the most overwhelmed, the most that is in need. What kind of plan do you have that may not be coming to the meetings that you offered?
If I may, Councilwoman Baker, one of the things that we're really blessed with in this county is we have awesome community partners. Center for Community Solutions being one among hundreds of others out there. We leverage that. It's not just the hundreds of programs that the county has. It's the hundreds of programs that the providers have, that the family centers have, the school districts, collaboration with Ari Gordon, CMSD. I mean, we're all in this together, and
Right.
leveraging those relationships so that we can be better is what takes some time, and that's what we're doing. But that's where we get to everybody, is when we can start leveraging those relationships.
All right, thank you. Thanks for your work.
All right, Director Pristo, I just wanted to touch a little bit on the basis of what Councilwoman Baker stated. In the past, in the previous government structure, the county was very good with outreach, very good, as whether it be at pamphlets, going out to the different communities, and actually touching bases with the everyday residents that needed the services or wanted to share what they had learned to their neighbor at church or whatever, because residents do know who's in need. And so I haven't seen us getting really back to that. I know it costs money, but you can have a small communication department. I believe in the past, each agency had one. They had an outreach department. We can do, a massive one and make sure that everybody is trained to talk about all the services and go out, because that is the only way that we're going to catch the ones that are most vulnerable and that really need it. And going door to door, recently, there's a lot of seniors that are scared to come out their homes. They're just scared to answer their door. So how do we reach those people? So we have to think. They do go to doctor's appointments. They do get on paratransit. What is it? How do we get them in order to be able to help them? So I don't think that we've done a good job in the new government in terms of that. I've always been preaching that we need to get back to what was working, and that was working. So hopefully we will do that in moving forward. I don't think there's anything else that I have. Is there any? John, do you have anything that you would like to share or anything like that? Okay. I do have one last question. Director Pristo, when will this booklet go out?
It went out to all my staff this morning at 7 o'clock. It's public knowledge now.
Okay. But
We're
I
also-
mean, are we mass printing it for?
No, we're not. What we're doing, though, to get to Councilman Miller's suggestion, is that we are making it much more simpler so that it can say what we need it to say without going through 80 pages and not confusing folks. So that's being developed right now as we speak.
Okay, and that comes under the current contract of making this? They're working the
We
same?
did that internally,
Okay,
ma'am.
all right. Any other questions? Councilman Miller?
Director, could you send us over a copy of today's presentation?
Electronically?
Yeah.
I think
Do
you
you
already
have
have it, sir. I mean, you'll
Okay.
get it from your staff.
Okay, great. And Madam Chair, Director, out of respect for all the work that was done on this and in support of your efforts, I would like to have my name added to the legislation as a sponsor.
All right. Any final questions? All right, Director, I must ask, I know this is probably behind, but do you need a suspension, second reading suspension, or can it go through?
Just go.
Go? Okay. All right.
If I may, I just the last comment I'd like to make is a lot of my senior staff is here that participated in developing this. I just want to say thank you to all of them that participated and spent hundreds of hours working on this and getting it together. So thank you, guys.
Madam Chair?
Hold on, Councilman.
I'm sorry, I just wanted to be clear. Did this go to all of the staff or just the senior staff?
All staff, all
Okay.
2,300 staff got this morning at 7 o'clock.
Okay, nice. All right, thank you.
Councilman Miller?
To the clerk, what was the official submission date on the legislation? And if we go to 3 readings, will we be within the 90-day window?
I'd have to check with Jean on the official submission date, because this was at the previous council meeting for August 8th. So you might want to do suspension.
Councilman Miller, I do remember talking to Jean in regard to that, and so I cannot remember the answer because we went back and forth for when we were going to schedule it. So I just would feel better if we did second reading suspension.
I so move.
Second.
Moved and seconded. All in favor say aye.
Aye.
Thank you, Administrator Pristo.
Thank you.
I'd like to have a motion to approve the minutes for the June 21st meeting.
Second.
Moved and seconded. All in favor say aye.
Aye.
Does any of my colleagues have any miscellaneous business to bring up? All right. Is there anyone signed in for public comment
No.
related to the agenda or not?
No, Madam Chair, no one has signed in.
All right, that's a shocker. That's the first. We're going down in history, folks. This meeting is adjourned. Thank you.